Genomics to me means the study of somebody's genome, how it would impact their health and their care. Uh, Ultimately, I think genomics means the improvement of patient care, and that could be direct care. There's a lot of work in the rare disease area, in oncology, and also moving out into pharmacogenomics. So there's lots of opportunity to influence and improve direct care, but also through research and how we make healthcare data available and genomic data available for improving research as well. So quite a long journey, actually, and I think probably starting out before genomics was really a thing. So originally starting out as a research technician in a small academic lab in Exeter, and one of my jobs there was to do manual DNA sequencing when it was still using radioactive bases to do that and reading up the old-fashioned autoradiographs, and then switched out into a university, University of Leicester, and worked in a core facility offering DNA sequencing services there, and moved over from there into laboratory management, eventually joining the NHS and the diagnostic service in Manchester, and then into leadership positions. But ultimately, it's always been around really enjoying working on the genetics and genomic side of things, but a long journey over many years now. Yes, from a family background of having a couple of members of my family who have passed away from cancer. I think it was more possibly the future opportunities that I would focus on there that maybe they didn't have, which was how in the future genomics might have impacted their care if there had been appropriate technologies and testing available at the time. Unfortunately, it wasn't the case for them, and looking forwards around cancer vaccines and areas like that, how genomics might come to positively influence and improve lots of people's care where that's not possibly the case now. Oh, proud of lots of projects that I've been involved in genomics. Too many to go into detail. The one that I am most proud of, just as we're working on at the moment, is all of the Genomic Medicine Service Alliance here in the Northwest, because it's been just really proud of how a team of subject matter experts have come together with an absolute passion around genomics, and not everybody was involved in genomics when they joined the team, but have brought their passion and enthusiasm. And it's quite amazing to see how far we've come in a relatively short amount of time, and what positive impacts on patient care we're having across a wide variety of areas. But really, yeah, really proud of the team that's been built around the GMSA, and how they enable me to learn every day, which is great. Uh, Most excited, I think, about the next phase of genomics, which I see as being the expansion out of the current rare disease and oncology areas, which are very targeted, very focused on individual disorders, into a much broader population level impact on healthcare, and predominantly in this next phase around pharmacogenomics, which is much more to do with how individuals' genes impact their ability to metabolize and their body to use medicines that they're given and prescribed. So I think that has the potential to deliver huge benefits to the population and the NHS as a whole. So really excited by that. And my role in that is supporting the GMSA team as the program director. So helping to support the team. We have lots of different people working on this, and a national collaborative now in this area, and seeing that mature, which we're just setting up at the moment, but seeing that mature over the next 2 years is tremendously exciting.